Good afternoon. Good afternoon. Welcome to another edition of Sunday Morning Transplant Coffee Talk. I am your host, Steve Belcher. So, this is a midday broadcast edition of Sunday Morning Transplant Coffee Talk. And I'm delighted to say we have a wonderful guest, our friend from the north of the United States, from Dartmouth, Nova Scotia, Canada, Karen White. What's going on, Karen?
Hi, how are you?
Pretty good. How about yourself?
Oh, I'm great.
How's the weather there today in Canada?
It's actually pretty nice. Just a light jacket today.
Mm-hmm.
All of our snow has melted, thank God.
How much snow did you have?
We had about 15 centimeters.
And what's that in inches for people who don't know the metric system?
That would be around seven inches.
7 inches of snow. Wow.
Yeah.
Did you have any trouble going to dialysis if you do dialysis on the outside?
We don't have any trouble here. My dad has a 4x4, so we're pretty good. And if anything were to happen and we were to have anything, a tragedy, the ambulance always comes and picks us up and takes us to dialysis. So we're pretty safe. We don't go without.
Oh, okay.
Yeah.
Okay. Can you tell us a little bit about your town, Dartmouth, Nova Scotia, Canada?
Well,
Just a little. Go ahead. I'm sorry.
we're home of Sidney Crosby,
Okay.
the famous hockey player. He's actually my parents' neighbor, and we're the city of lakes. We have beautiful lakes here. It's a wonderful place to live. Everyone's so kind and wonderful. We have wonderful neighbors. It's we're really happy here.
Wow, that's wonderful. Now let me ask you, in your town, what's the population? I mean, estimate.
Probably around 10,000.
10,000.
Yeah.
Now, compared to the United States, are there a lot of renal dialysis treatment centers in your town or just in Canada alone?
So we don't have dialysis centers. Ours is all in hospital.
Okay.
And we are very lucky to have two hospitals very close. I travel about a half an hour to get to mine, and that's in
Mm-hmm.
Halifax, Nova Scotia. Um, all of our nurses are absolutely fantastic. Um, the dialysis unit's very clean. Everyone's very kind. You can really feel that the nurses have their whole heart into it.
Wow. Wow. What size treatment center is it?
Where I'm at, there's
Yes.
about 15 seats. And just across from where I'm at, there's about 40 seats
In another building?
in another building, right? So
Wow.
where I'm at, it's called the Halifax Infirmary, and the other hospital is called the VG Hospital, Victoria General Hospital.
Wow.
Right.
Wow. Is kidney disease prominent just like here in the United States?
Absolutely.
Really?
Absolutely.
Does it list the top of um, deaths of diseases in Canada? Like here in the United States, it's the ninth leading cause of death in the United States.
Wow. I would say it's close. It's in the definitely in the top 10.
Really?
Yes, it is. It's so scary that there's so many people, friends and family, my nephew, my disease is glomerulonephritis, which
Okay.
is um not usually found in regular families. Um,
Right.
but my nephew was diagnosed when he was little with the same disease. When I was diagnosed at age 12, there was about 6 or 7 other kids in the hospital from my same town, Cole Harbor, and we all had the exact same disease.
Really?
Mm-hmm.
And then that was glomerulonephritis.
Yes.
Wow.
Mm.
Wow. Did they attribute it to environmental concern?
No, actually, they said mine was from strep.
Okay.
Yeah,
Okay.
yeah. That
Wow.
my body turned my immune system on to kill off the strep and killed off my kidneys. So, in order to stop my immune system, they had to put me on chemotherapy.
Mm.
So I was
Mm.
12 years old on chemotherapy. It was pretty scary.
Right. So since you started there, let's just tell us how your journey with kidney disease started up to this point.
Well, I started, like I said, when I was 12. I was on dialysis in hospital, and I was there until I was about, yeah, 19. And then, thank the Lord, I was transplanted. I had a wonderful kidney. It lasted me 7 years. And after that, unfortunately, the prednisone stopped working. So they decided to take me off of it, and my kidney failed. Um, then I went back on dialysis, and I was on dialysis until 2010. Then I got my second kidney. Wonderful, wonderful time with my kidney. I did so much, learned so much, went back to school as an older student. Um, my kidney, I ended up developing a chronic diarrhea, and I wasn't absorbing my Fortic anymore because it would go right through me. And so it just it just stopped working because the anti-rejection drugs just weren't being absorbed. Um, and then after that, they found out I had lupus. So I'm quite the case. And that brings me here today. I'm on dialysis again. Not enjoying it. It's something
Right.
we have to do. We don't have a choice. Well, I mean, we do have the choice, but we know the consequences. I've never missed a treatment. I follow my diet. I do everything I'm supposed to do because I want that next kidney. And
So,
sorry,
oh,
I know if they see that I'm doing everything I should do, then they will transplant me again.
right. When you said you started with kidney disease at 12 years old, did you ever start any type of renal therapy treatment at 12?
No, it wasn't until I was 15 that I started dialysis.
And what
But
was that, in center or
in
at
center.
home?
Yeah, in center. I've never done at home dialysis because I want to leave that at the hospital. I want to have my home, my comfortable home. I don't want to have to, look at a machine and think, "Oh, I've got to do that again tomorrow." So,
Yeah.
I leave that at the hospital and keep my home, my
No,
sanctuary.
you're the I heard other people say the same thing. So, yeah, I can't say I can relate, but I can pretty much understand that you don't want to intertwine the two together.
Exactly. Yeah.
Hmm.
Yeah. Your home
So,
is your safe place, and I find when I'm at my home, I feel safe. When I go to dialysis, it's like it's a whole new world.
hmm, do you
Mm.
feel safe at dialysis?
Not so much. Well,
Hmm.
I feel safe. I just don't feel comfortable.
Hmm.
Yeah.
Right. When you was going to dialysis as pediatric, were you at a pediatric unit in Canada, or were you mixed in with adult patients?
No, we were at what's called the IWK, and that's a hospital for children. It's like I think there's sick kids in the States somewhere, I believe. So it
Hmm.
would be like the same as that, and there was probably 8 chairs, and we were all family. It all became family.
That's what I was going to ask you. Did y'all treat it as family and
Yeah,
talk outside of the dialysis unit?
definitely. I feel more so when we were children. Now that we're older, I don't feel that I'm like family anymore, I guess, because
Hmm.
I mean, we're just another number, I feel, you know? They've got to get us in, get us treated and get us out. There's so many people coming down with this illness, and there's only so many hours in a day that everyone's got to get treated, right?
Wait a minute. Let me digest this. So you just said that and you're at a hospital. It's not like it's a big corporate dialysis company like here, DeVito Fresenius. You're at a hospital, and they have the mindset that you just said: get them in and get them out.
Mm.
It, I mean, is that because there's so many patients that they got to run so many shifts?
Yes, yes. And here, I don't know if it's the same there, but you're either on Tuesday, Thursday, Saturdays. So God
Mm-hmm.
love the nurses, they still work on Saturdays, or Monday, Wednesday, Friday.
It's the same here. Just like today, it's Sunday, but their units open because they'll be closed on Christmas.
Right, right.
Mm-hmm.
See, with
Mm-hmm.
us, I'm not sure how the Tuesday, Thursday, Saturday group goes, but we are going Monday tomorrow. So,
Mm-hmm.
so we'll be off Tuesday for Christmas.
Right. You are Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday.
I'm a Tuesday, Thursday, Saturday.
Right. You're going to go tomorrow. Monday, Wednesday, Friday is today, and then I believe on Thursday it will be Monday, Wednesday, Friday, and then Friday it will be you. And I'm trying to remember how it goes because it's going to be the same way on New Year's Day as well.
Exactly.
The same schedule you have today is going to be next week, and then it goes back to normal.
Exactly.
But yeah, we run the same treatment schedules here as well. But I would at least thought, like in Europe and Canada, when it comes to renal therapy treatment, that it wouldn't be so kind of like a rushed environment. But it almost seems like that's not the case, what you just mentioned, because so many people are coming down with it. What is the uh, main cause that's causing kidney failure there?
I would say it's diabetes.
Mm-hmm.
Hmm.
Mm-hmm.
It seems
Is
that
there?
there's just so many people with diabetes on dialysis, and if I'm getting treatment, it seems like if I look to my left and I look to my right, they're both people with diabetes, whereas I'm the odd one where I don't have that. I have the glomerulonephritis and
Right.
lupus.
Now that's diabetes type 2.
Yes, it is. Yeah.
Mm-hmm. Is there a lot of fast food restaurants in your area or Canada alone?
So many, so many. Tim Hortons is the big chain, major coffee shop, which has sandwiches and things like that.
Mm-hmm.
And they're attached to a Wendy's, and you just see so many people eating so much fast food and McDonald's, and it's everywhere.
So, do you think it would ever get to a point where there would be independent Canadian dialysis companies opening up to help relieve the burden on the hospital system?
I really am not sure. I think it's a possibility. But with our medical system, I don't know how that would work, where we have free medical, in Canada.
Wait a minute. You said you have free medical?
We have free treatment. We don't pay for dialysis.
Wow.
Yeah,
I didn't know that.
I don't
What
pay a
about
penny.
the medication?
My medication, I have a plan through work. So I don't pay anything. I actually have a plan myself and a plan through my husband's. So I pay zero copay, nothing for dentists, nothing for prescriptions, except my anti-rejection drugs.
So your dialysis treatment is free.
It's free.
Wow. So let me
Zero
ask you,
dollars.
do you have to meet a certain criteria before you start dialysis? Like for instance, do you have to be like at stage 5, does your numbers have to be less than 15, less than 10? Does it have to be a certain number at stage 5 for them to initiate dialysis, or does it happen when the person experience symptoms related to the disease?
When I lost my kidney, I didn't have any symptoms. I was really disappointed when they told me I needed dialysis, and I was a fighter. I fight against them all. And we wait till the creatinine is 1,000. And I'm not sure what that's.
What? Wait a minute. You wait till the creatinine is 1,000?
1,000. And I think your guys' numbers are different than ours.
Yeah, yeah. Wow, wow.
Yeah.
Um.
A big problem we have is phosphorus.
Okay.
Big
Okay.
time. Big time.
Wow. Um. Do they offer home dialysis in Canada?
Yeah, they actually wanted, they said I was a perfect candidate to do home dialysis. And I went and we had the meetings and the talks, and they told us what they were going to do to the house. And I just decided that, you know, this is my home, this is my safe place. I don't want to bring that into my home.
Mm-hmm.
Mhm.
Mm-hmm. You mentioned that. Did you know that here in the United States, Medicare, which is part of the United States government, pays, don't quote me, I believe $260 reimbursement to dialysis companies for treatment for patients on Medicare. So what's been happening in the past is some of these larger chains, with the Obamacare, I'm sure you heard of that,
Mhm.
Obamacare. So what they was trying to do, because you have an existing condition, a lot of these big companies were steering patients, mainly minority and patients who really didn't know any better, stared them in this Obamacare, and you had certain companies or insurance companies, mainly um, Aetna and United Healthcare. So instead of now they're getting private insurance. So instead of now getting the $260 from Medicare, now they can charge up to 5 to 6 times, 7 times the amount, up to $4,500 per treatment. So,
Yes. And I went with my family to Florida, well, probably about 15 years ago, and I went to Davita, and I had wonderful care. It was very costly though, because where I wasn't home, I have to pay for the treatment.
mm-hmm.
And don't quote me on this, but I think it was $3,000 a treatment. And
Wow.
and that's out of pocket. However, when we come back home, we get reimbursed a percentage.
Wow. Wow. See, some people would probably be jealous watching this, saying, I mean, as much as we get charged down here and up in Canada, you can go to dialysis free.
Mm-hmm.
So, I mean, that's a big deal to a lot of people. I mean, that could almost be a move to Canada, especially with someone who may, able to afford that. And if they can't get a transplant, they always know that they can go to Canada and get free treatment. I
Mm-hmm.
mean, can someone who moved from the United States move into Canada qualify, or has to be a natural born Canadian citizen?
Uh, I believe if they were to go through the process and become a Canadian citizen, I'm not sure 100%, but if they're a Canadian citizen and they pay their regular fees, I don't see why not.
Mm-hmm.
Mhm.
Mm-hmm. So, what else pertaining to dialysis that the Canadian government pays for free?
Um,
Do they pay for the transplant?
oh yes, I don't pay anything for a transplant. The reason I pay a portion for my transplant is because I want a private room, a private hospital room. And with my plan, it covers a joint room with 4 other people. And I like my privacy, so I'll pay the extra $100 a day to have my own room.
Mm-hmm.
Hmm.
Mm-hmm. So tell us about your first transplant experience. Since you're a two-time transplant recipient, can you just take us back to the day you received that call and you knew for sure that this was going to happen?
Oh, I'll never forget it. I was in bed sleeping, and the phone rang, and my father answered, and I heard them say, "Oh my, oh, I might get teary eyed." I heard them say, "It's a kidney. Kim got a kidney." And then they came into my room and woke me up and said, "They have a kidney for you." And I just couldn't believe it. I was in absolute shock. Um, all I could do was cry. I was so emotional. I was so happy to be able to come off dialysis and to try to live a normal life. It was magical.
Wow.
Hmm.
So, in contrast, when did you find out that that first kidney was rejecting? And how did you take that news?
Very, very upsetting. Um, they the hospital didn't feel that the prednisone was really benefiting me. So as a team, we decided to discontinue the prednisone. And after a few months, we could see my creatinine getting higher and higher until it was too late.
Wow.
Mhm.
Wow. So, did they remove that first kidney?
Oh no, I have 4 kidneys in me. I have my 2 native kidneys and my 2 transplants. I'm full.
So, in that essence, you're on the when you get back on the transplant list, where would they put uh, the kidney once you get it?
So when I get the new kidney, what they'll do is, when they open me up, they'll remove one of the kidneys that are in there, and they'll replace it with a new kidney.
Okay, okay, okay. Wow. Um, do they recommend not doing that, or they encourage you to go forward with the transplant since you have 4 kidneys inside you?
They want me to continue, and then we'll just go through that extra
Hey,
surgery
Kim,
time.
think you froze up.
Oh, can you see me? Or I should say, can you hear me?
Hey, Kim, you there?
I'm here.
Yes, we froze up for a moment.
Are we good now?
Okay, keep talking.
Okay.
Can you hear me?
I can hear you loud and clear.
Hi, Kim, can you hear me?
I can, yes.
Wait a minute, guys. We're having technical difficulties. Yeah, we're having technical difficulties. Hello? Yeah, can you hear me? Can you hear me, Kim? Can you hear me? Yeah, I'm having some technical difficulties here. Can you hear me?